Let's talk about coronavirus. Our health is at risk. This afternoon, China says it is making significant progress towards finding a cure for that deadly coronavirus said to have killed so many. The death toll from the outbreak has now reached 361 on Monday, with Philippines recording its first death. Over the last couple of days, we've been talking more about the deaths, the number of people who have died. Well, today, we're putting the spotlight on government response, the progress at least has been made. Chinese ambassador to Ghana, Wang, has been speaking about the progress that his country has made in dealing with this issue.
WHO praised our efforts as record-breaking in the shortest possible time. They allow all the countries to properly develop the diagnostic reagent, enhancing the capacity for identifying the cases in time. Vaccine and pharmaceutical research is a race against time. Experts from China and across the world are actively involved and have made progress. A few days ago, a key Chinese laboratory isolated 3 virus strains which could be used for developing a vaccine. Institute of the Chinese Academy of Science have screened out several medicines which could help contain the virus and have the potential for clinical application. This is good news. But now this is a process. It's making progress.
That's the Chinese ambassador to Ghana, Wang, there on the progress that his government has made in dealing with it. This afternoon, we'll take you to Wuhan, where China has put up a 1,000-bed hospital within a matter of 8 days. Well, some incredible news there. Well, but let's first of all bring you some details of those hospitals. And it's the Wuhan Hospital is located in Wuhan, that is central China, which is also the epicenter of this epidemic. It covers an area of 25,000 square meters with a capacity of 1,000 beds. So 1,000 people will be able to be can be admitted in this facility, and they have a staff of already 1,400 to take care of the 1,000 beds or 1,000 people that's possibly going to inhabit this new hospital. Well, let's talk about the Wuhan Hospital. The Wuhan Hospital is located in Jiangxia district, Wuhan, central China. And the construction started in January 25. It has a capacity of 1,600 beds and it's expected to be completed on February 5. The hospital is fully covered by 4G and 5G mobile telephone signals. So that's the second hospital. So if you put together the 2 hospitals that are being constructed, they'll be taking care of 2,600 at a goal. And this hospital has been built in between 6 to 10 days. Let's take you inside the Wuhan facility, which started receiving patients today. This video is courtesy Chinese TV station CGTN.
Of the hospital, and today we have this opportunity to bring you the shots inside. And this is one of the ward. You can see it's 2 beds per room, which means 2 patients in 1 ward. And they have, this is very soft. And I can tell this is all brand new. And everything actually benchmark is the standard hospitals. You can see we have the kit and also the other supplies. And we also have the oxygen pipe. So if the patients need to take oxygen, then they will have the pipe from here. And they also have the different material supplies, equipment. The cupboard, and also you can see the air conditioning because still right now the temperature is quite low. We're still in winter. And also the ventilation pad, this one. So we look at actually the air for ventilation already is purified. So this is one thing I would like to highlight. So look at the metrics and also is of the medical supplies. And right now, the workers right now doing the final checks on water supply and electricity supply. And we also have the air purification. And for this one, I believe you don't really see this in normal hospital. This is dedicated and specific for the warned with novel coronavirus patient. So it's transparent. So we can see this is like a window. So basically, this is to prevent the cross infections. This is to protect our medical staff. So basically, you would like to pass the stuff, you put it in this transparent box, and the patient can get it. And we also have toilet. So it's a little bit dark because the workers right now doing the final preparation. You can see the hot water.
So that's an inside view of that new hospital that has been constructed by China. Well, let's get on the line. We speak to Chairman of the Coalition of NGOs in Health, Dr. Gabriel Banaku. He's also a social medicine expert. Dr. Banaku, thank you very much for your time.
Thank you.
Well, first of all, what's your assessment of this coronavirus outbreak in China and how fast it is spreading?
Yeah, I must say that we have learned a lot of lessons from China and from the WHO. There has been very well coordinated efforts globally, and the capacity to respond has been very effective. And we expect to see the same thing in Africa. And having learned from these developed countries and also having taken clue from the advice from WHO, we expect to see more within the Africa sub-region, and more especially within the West Africa.
Well, two quick things I'd like to engage you on. Some doctors are saying that even though the U.S. has introduced some travel restrictions, China is not very happy about that. But people are saying that even in Ghana, we should be able to do that, and that's a sure way to protect our citizens from the disease, entering, especially for those coming from China.
Yes, as a country, even though we are governed by the Africa Charter and the ECOWAS protocols, we still have to be very, very of ourselves. But we also have our internal mechanism and laws. We need to, even though we cannot prevent, but we must strengthen our system in a way that we should be able to do early detection. Other than that, if we slip off, it can be very disastrous for us as a country, because we still have very weak health systems in Ghana. We are still struggling with our common annual outbreaks. So even though we are taking a lot from WHO, if you notice how the Ministry of Health, Ghana Health Service responded and trying to bring the multi-stakeholders together, we still have to do much more in terms of facilities, in terms of human resource, and also in terms of education in the country. So we still have to do more.
You agree with the call for travel restrictions?
It may not be total restriction, but we have to strengthen, as I said, because we are governed by some protocols and some international laws. In Ghana, we do not have too much muscle to behave like the Americans, but we only have to stick to the standard implementation from WHO. And if we do that, we should be able to prevent early warning sign and intruders into the system. And I keep on saying that we are still not doing much in our border areas. So if we play around and we have 1 or 2 cases, then it can be disastrous in Ghana. So we don't pray for that, but we are not seeing much in the, apart from Accra, we are not seeing much in the Bonahafo Sampa area. We are not seeing much in the Nandom area. We are not seeing much in the Bunkugu Yonyo area. Bolga, we want to see more in the Upper East. We have to be prepared. We have to increase our response.
Okay. Well, that has been the chorus. A lot of people saying that Ghana ought to do more to protect its citizens. In the meantime, Chinese ambassador to Ghana, Xiting Wang, has also criticized countries evacuating its citizens and shutting down its doors to persons who visited China in recent times.
The U.S. rushed to go in the opposite way. The U.S. is the first country to evacuate its citizens from China. The United States is the first country to ban its citizens to travel to China. The U.S. is also the first country that banned all the foreigners who have been to China in the past 40 days to enter into the U.S. The U.S. Commerce Secretary even said that the coronavirus will help bring back jobs to the United States. Certainly not, this is not a gesture of goodwill. You know, what's more, the U.S., as the biggest economy in the world, has not provided any assistance to China on the epidemic issue so far.
That's the Chinese ambassador to Ghana, Xiting Wang, there criticizing the United States for that action, which experts are also calling for here in Ghana. Well, the Ghana Medical Association also has issued a statement on coronavirus and Ghana's preparedness. They're saying that Ghana must be prepared in terms of logistics, protocols, and trained personnel to deal with a possible case. It goes on to talk about to call on the Ministry of Health to strengthen the surveillance systems at the point of entry into Ghana as well as within the country. It says we call for adherence to the various international and local surveillance guidelines and protocols in all health facilities, ports of entry, as well as improved public education on the signs and symptoms of coronavirus infection at community level. It says that there is an urgent need for the reactivation of a well-coordinated rapid response team like the one set up during the Ebola pandemic. We urge doctors and other healthcare workers who were trained as part of that response team to immediately regroup and get involved actively as we strengthen our preparedness towards any possible case of coronavirus. The statement ends by saying that government on its part must adequately resource the healthcare system, including rapid response team. There is an urgent need for an improved official communication system in the health sector to support rapid dissemination of authentic information, and that's key as far as dealing with outbreaks are concerned. Quick and rapid information. The general public is advised not to panic, but observe all the infection preventive measures that Ministry of Health has provided, especially frequent hand washing with soap and water and observing cough hygiene. We also advise Ghanaians to avoid international travels to the affected countries unless very necessary and observe all travel precautions as described. It is signed by Dr. Justice Jansen, who is the General Secretary, and Dr. Frank Ankobia, who is the President of the Ghana Medical Association. So they're calling on government to do more, calling on you, the individuals, to make sure that you protect yourself from this infection.